Thank you, Meredith. Once again, a very warm welcome to everyone to this webinar from wherever part of the world you're from, all protocol observed. We are grateful that we have this opportunity to share with you the experiences from the Uganda Health Systems Strengthening Project that began in 2019 and is in the final days of conclusion, ending September 30th. So it's a great opportunity to share these experiences and lessons with individuals from across the globe. So I'd like to briefly take you through our agenda. We'll have the opening remarks, which we're already having right now, from Meredith and myself. We'll then have an overview of the Uganda Health System Strengthening Activity. We'll look at the achievements of the project over the past 5 years. We'll have a question and answer session. And like my colleague Meredith has mentioned, please feel free to put those questions in the chat box. We'll be able to respond to them in real time, either through the chat, or have some discussions as we go along. We'll then have experience sharing, where we have a couple of panelists from the Ministry of Health and across the health sector in Uganda. We'll also share with you a brief video on the UHSS achievements during the session. So at this point, I'd like to invite Mr. Thomas Minor, who is the Chief of Party of the Uganda Health System Strengthening Project, to give an overview of UHSS. Over to you, Thomas.
Thank you very much, Simon. Distinguished guests, esteemed colleagues, and valued partners, it is with immense pride that I welcome you to this webinar that marks the conclusion of the USAID Uganda Health System Strengthening Activity. On behalf of the entire UHSS team, I extend my heartfelt gratitude to each of you for joining us today as we share and reflect on our remarkable journey. Over the past 5 years, UHSS has been more than just an activity. It has been a testament to the power of collaboration, innovation, and commitment. Together, we have worked tirelessly to strengthen Uganda health system, empower communities, make a tangible difference in the lives of the countless individuals. The story we will tell you today will showcase the achievement and successes. As we reflect on our journey, we also recognize the invaluable lessons that will undoubtedly shape the future of health system strengthening efforts in Uganda and beyond. I invite you to join us today as we reflect on and learn about UHSS achievement, share lessons learned, and envision a future where all Ugandans have access to quality healthcare. Now, a brief overview of UHSS. USAID UHSS aimed at enhancing performance of Uganda health system through technical assistance and capacity building. UHSS was implemented led by Palladium as the prime, in collaboration with Civil Society Budget Advocacy Group, Infectious Disease Institute, KPMG Uganda, and Panagora Group. All these partners bringing different expertise to strengthen the consortium. Next. During implementation of USAID UHSS activity, we collaborated and coordinated with several players and stakeholders. Key among them was the government of Uganda ministries, department, agencies, district local government, and partners. Next. In terms of geographical coverage, UHSS primarily focused on supporting 77 USID districts and 7 regional referral hospitals. UHSS also implemented a malaria-focused intervention in 15 PMI targeted districts with the overall goal of strengthening community systems to defeat malaria. However, our human resources for health, PFM technical assistance was provided nationally, covering all the 135 districts and 11 cities. Next. Now, this is our results framework. Now, to achieve UHSS goal of improved performance of Uganda health system, we focused on 3 key results areas that include improving leadership and accountability, increasing availability and management of health system resources, and strengthening community health system. To achieve the 3 key results areas, we implemented several interventions under 5 key thematic areas that include governance, leadership, and accountability, health financing, including public financial management, health information system, human resources for health, and community system. Next. This slide basically provides a summary of the results areas under each level. Next. Now, USID UHSS employed multiple technical approaches to providing technical assistance based on context and needs. These technical approaches that we implemented include embedding a team of experts within the Ministry of Health and selected regional referral hospital, designing and demonstrating several pilots or innovation, and these include the community health extension worker pilot, the micro health insurance pilot. The other strategic approaches include capacity building, including on-site and off-site virtual training, intensive on-site expert mentoring for a short period of time, and creating platforms for sharing data use, learnings, and adaptations. Next. Now, throughout the 5 years, USID has made significant contribution to improving the lives of many Ugandans. Next slide, please. Now, I want to share with you a few of the high-level achievements. Next. Throughout the 5 years journey of implementing the USID UHSS project, we have achieved significant contribution to improving the lives of many Ugandans. We have seen more than 10 million people tested for HIV/AIDS. We have also seen a 5% increase on people living with HIV tested for viral suppression. Worth noting is also an 11% increase of people living with HIV on antiretroviral therapy achieving viral suppression. Additionally, we have seen a 9 to 22% improvement in antenatal care attendance in the 3 community health extension worker pilot districts, and this is after 2 years of implementation. Furthermore, we have achieved a 30% reduction in malaria positivity in the 15 PMI target districts and a 43% malaria reduction in the 15 PMI targeted high malaria sub-counties, covering at least 1 sub-county in each of the 15 districts. I will now invite our Deputy Chief of Party, Dr. Betty Atai, to share with us the achievements that we realized under each of the results area. Over to you, Betty.
Thank you very much, Thomas, and good morning, good afternoon, and good evening from wherever you may have joined us. Allow me also add my voice in welcoming everyone to this, to learn about the achievements and lessons we have gained over the past 5 years of implementing this USAID Uganda Health System Strengthening Project that was implemented by Palladium. So in the next section, we will be discussing each of the 5 result areas as mentioned by Thomas earlier. And we will start with, next slide, please. We will start with the health financing and public financial management key result area. And for the sake of bandwidth, allow me turn off my camera as we proceed to the next slides. So over the 5 years under the PFM key result area, this project has made significant strides in increasing the government total health expenditure to about 21.7%. And this has ultimately contributed to a reduction in the out-of-pocket expenditures to the Ugandans by nearly 11%. And hence, this has increased financial risk protection for our populations. In addition, through targeted budget advocacy efforts, the project, working with the consortium members and the government institution, successfully secured a 1.1% increase in the national health sector budget as a proportion of the total government of Uganda budget, rising from 7.4% to 8.5%. Now, this accomplishment highlights the positive results of continuous advocacy efforts for increased budget allocation to the health sector. Another notable example of such success is the allocation of an additional 25 billion Uganda shillings to the Ministry of Health for upgrading of health centers and renovation of health facilities in the financial year 2023-2024. And also the 2 billion Uganda shillings that was allocated to the Mulago National Referral Hospital for maintenance of equipment that are critical for the delivery of quality health care services. And as UHSS works with partners to increase financial resources for the health sector, the project has also played a very critical role in improving budget execution at both the national level and at the district level. At the district level, we are proud that we saw a 92% budget execution rate. And this is really happening at the level of implementation of health services, meaning that more resources are now made more available to the district level to support the implementation of essential health services. At the national level, key to note, the Uganda Health System Strengthening Activity worked with the Ministry of Health to increase absorption of donor funding, especially the Global Fund Project Fund, from a mere 7.57% to a remarkable 75%, indicating a substantial improvement in the utilization of this donor funding for the activities that they were meant to deliver on. Next slide, please. Here, I would like to highlight our efforts in increasing domestic resource mobilization, where we worked to increase funding for the HIV activities at the district level. First and foremost, the project supported 67 districts to develop costed HIV and AIDS strategic plans that were utilized to align all partners to the epidemic control targets. And the districts used this to also guide implementation of the HIV response at the decentralized level for the 5 years. Thereafter, UHSS worked with both the national and the district level to increase government contribution to the HIV response. At the national level, on my left, you see that The government of Uganda contribution to the HIV expenditure increased from 8.6% to 13.3%. Please move back to the previous slide. And at the district level, UHSS utilized directives and facilitated the district to implement the 0.1% directive to allocate 0.1% of the district budget to HIV mainstreaming activities. And that saw over 15.7 billion mobilized through just that effort for HIV mainstreaming activities. And many other achievements are shown to you on this slide, and we will be sharing some of the details of these achievements in nuggets that will be shared at the end of this presentation. Next slide, please. So here we share some of the lessons learned, and I'll just highlight one or two. So we learned quite a lot under this area. One of the key lessons we have learned is that positioning budget absorption discussions at the top management meetings not only increases the leaders' awareness about how resources are being expended, but also fosters better budget absorptions within the health sector. Another key lesson learned is the critical role that institutionalization plays in ensuring the sustainability of health expenditure reporting, as we have experienced in implementing the activity-based costing, the national health account, and the national aid spending assessments. Next slide, please. So overall, the health financing key result area improved the availability and utilization of financial resources. And now we'll move on to talk about the human resources for health key result area. Next slide, please. So under HRH, the UHSS activity worked with key stakeholders to increase health workforce, both in terms of numbers and in skills. By mid this year, the health workforce had increased by over 24,699 more health workers into the system, hired and deployed and available to provide quality healthcare services. This positive trend is expected to continue due to the revised structure that UHSS again supported the health sector to develop, that has opened up over 200,000 new positions with an improved skill mix that aligns to the current context and the current disease burden of the country. And now that the ban on recruitment has been lifted, there is hope at the end of the tunnel. One other important aspect of this project, made possible through the generosity of USAID and the American people, is the secondment of health workers in the government of Uganda structure. When UHSS came into existence in 2019, UHSS inherited approximately 770 healthcare workers whose salaries were funded through PEPFAR. In an effort to promote sustainability, the project worked closely with the Ministry of Health, the district local governments to transition some of these staffs into the government of Uganda structure. And we've made significant progress with nearly half of the staff members successfully transitioned in the public health facilities. However, to ensure long-term sustainability, additional funding is needed to absorb more PEPFAR staff, and especially those working in the private not-for-profit facilities. So it is important that the government prioritizes allocation of funds to support the successful transitioning of the remaining staff in the spirit of sustainability, and this we think is achievable. In terms of staff productivity, next slide, please. In terms of staff productivity, UHSS supported the ministry. Please go back to the previous slide. In terms of staff productivity, UHSS supported the Ministry of Health upgrade digital tools to facilitate performance management, including the IRIS, the Integrated Human Resource for Health Information System. This system is able to track attendance to duty as well as other performance management dashboards. All have been currently institutionalized, and utilization is currently driven by the MOH itself, speaking to our localization efforts as we work with the ministry to deliver on tools that are going to be utilized. The IRIS is going to be an important tool and has been an important tool in the human resources for health audits, and will also be providing data for HRH planning. Next slide, please. So here are a few lessons learned. And one of the lessons that we have learned over time is that wage analysis and recruitment planning are crucial elements as they effectively and efficiently utilize available resources to begin with for health sector recruitment. And the other lessons, as you can see on the slide. Next slide, please. So I will now move to speak to you about the community health systems. Next slide. So under UHSS, the activity has been instrumental in creating an enabling environment for strengthening community health systems through the development of key policies, strategic frameworks to align stakeholders, and tools to support the implementation of the community health program. Key among this is the first ever hosted national community health strategy that was developed with support from UHSS and other partners and is currently being utilized for strengthening community health programming in the country. We also supported the development of the Integrated Community Health Service Package and the Community Health Investment Case, as well as the National Community Health Education and Promotion Handbook, a critical tool that helps community health workers as they provide health promotion activities at the community level. To strengthen accountability, especially social accountability, UHSS also supported the Ministry of Health to develop the client charter, and this charter was translated into 9 different local languages to cover the entire all the regions in the country. From a health workforce perspective, UHSS has been at the forefront of all efforts to establish a highly skilled, digitized, well-equipped, supported, and fairly compensated community health worker, known as the Community Health Extension Workers, or the CHUs. Currently, we have 3 local governments that have successfully implemented the CHUs pilot, with 336 of these CHUs traceable in the Community Health Worker Registry that was again upgraded and developed by the UHSS and deployed to deliver better quality services working with the existing VHT system. Throughout the implementation of the CHUs pilot, UHSS generated valuable evidence that has so far informed the expansion of the CHUs program by the Ministry of Health to an additional 20 districts within the coming years. Next slide, please. So 2 important lessons we highlight implementing community health system strengthening activities. One is that sustaining community health intervention calls for a continued stakeholder engagement and securing domestic funding. The second important lesson that we have learned is that institutionalizing data use for decision-making at all levels is very critical for impactful decisions that actually save lives. Next slide, please. So we were privileged to also receive funding under the President's Malaria Initiative. And the picture you see on the right shows one of the malaria smart schools that were established working with the Budaka district. Next slide, please. So with support from PMI, UHSS successfully implemented a hands-on community health system strengthening program in 15 districts that were identified as high malaria burden districts. Through the use of a sustainable district-led and community-led approach, as well as the use of existing structures and data-driven targeting of interventions, our program achieved significant milestones. The program led to a sustained reduction of malaria positivity in the selected sub-counties from 69% to 39% over the 2 years of implementation. And that impacted on the overall aggregate district reduction from 54% to 38% over the period of 2 years. Now, these results demonstrate that strengthening health system interventions significantly contribute to the sustained reduction of the malaria prevention in the community, because 12 out of the 15 districts only had health system strengthening approaches implemented to reduce the malaria burden. This impact is, however, amplified by implementing a comprehensive malaria program that includes vector control measures, the use of the insecticide-treated nets, ICCM, as well as community engagement, as we learned from the 3 districts that implemented comprehensive malaria programs with support from other partners. Through the targeted and consistent community engagements in the remaining 13 districts, UHSS reached over 70,000 individuals through 590 community dialogues focused on malaria prevention and early treatment messages. And this, coupled with other health system strengthening activities to strengthen community supply chain, we strengthened community health information, and others, have made an impact in reducing malaria in the communities that we worked with. Next slide, please. So these are the lessons learned. And the first lesson that we learned implementing the PMI program was that effective malaria prevention requires a comprehensive and large-scale strategy that extends beyond the community engagement if we are to significantly control and ultimately eradicate malaria in the country. The second lesson is that strengthening health facility capacities to manage commodities and for the districts to own the community health initiative as part of their population response does significantly impact informed decision making. Next slide, please. So we will now look at our efforts to strengthen health information systems. Next slide. So UHSS contributed to improving the policy environment in line with the Ministry of Health digital health strategy and supported improved reporting for both the public and the private health sector. So we are part of the discussions in developing most of the strategies for digital health. We have developed and institutionalized tools to facilitate data use, such as the portal of dashboards, the community health dashboards, and these provide easily digestible information to health managers for decision-making at a click of a button. The UHSS has also been instrumental in supporting the Ministry of Health in developing key decision-making tools such as the performance management dashboard for the national level and the subnational level. And the implementation of these tools is expected to improve the performance of the staff and ensure that healthcare workers across the entire system are accountable to those who they work with. And while these tools have gained a lot of traction at the national level, progress at the subnational level has been limited, and this disparity has provided valuable insights for us, highlighting the importance of incorporating change management strategies to drive the adoption of digital tools, especially those that promote accountability effectively. Next slide, please. So under governance, leadership, and accountability, next slide, please. The UHSS worked to provide technical assistance to strengthen the governance at the national level, but also at subnational level, particularly at the regional referral hospital. The support was critical because at the time that the UHSS activity came on, the regional referral hospitals were for the first time receiving donor funding through the G2G mechanism. So UHSS supported the re-establishment and capacity building for the regional referral hospital management boards that were providing oversight over the hospital management and the projects, including the G2G project. In addition, the UHSS worked to establish what we call project coordination teams to support the implementation of the G2G project in all the 7 regional referral hospitals. These project coordination teams were pivotal in attainment of the milestones as they held the project staff accountable for the results. One other achievement under the leadership, governance, and accountability key result area was seen in the support to the regional referral hospital to its newly delegated function of improving health services within the districts in their catchment area through the hub and spoke model. UHSS supported the development of the comprehensive support supervision strategy and the national support supervision guidelines to support the hub and spoke implementation. At the same time, UHSS worked tirelessly to strengthen the capacity of the regional referral hospital to take leadership and strengthen the capacity of the community health department to lead certain aspects of the new mandate, which included the support supervision, performance review meetings, continuous quality improvement activities, all geared towards improving service delivery and the overall health outcomes in the region. Today, we are proud to say that most of the regional referral hospitals have taken ownership and are fluently leading regional joint review meetings and utilizing these as accountability platforms for the districts within their catchment area and are taking on simple but impactful decisions to improve health care services. This, coupled with a data-driven targeted technical support supervision to the lower level health facility, has led to the development of innovative solutions, such as one that we learned recently from the Lira region, where they practice reverse referrals that have improved the skills of health workers at the lower level to deliver quality services, including emergency obstetric services. And this has also been seen in other regions where supportive supervision has led to key decisions in Mbarara region and in Mbale region that have impacted the service delivery. Next slide, please. So these are some of the lessons learned, one of which is that on-site joint performance reviews have improved the effectiveness of technical support supervision and the synergy between stakeholders when they get together at the lowest level of implementation has promoted harmonization and prevented duplication of effort. The second I would like to highlight is that supervision teams reviewing data prior to supervision visits has really helped us focus on the things that matter, and decisions that have come out of data-driven supportive supervision have clearly had an impact in service delivery. Next slide. So now I'll speak about the key takeaway messages. Next slide, please. So one of the key takeaways that we'll speak about is the regular mentoring and supportive supervision that I alluded to earlier are crucial for enhancing and sustaining front health worker knowledge and skills. And not only does it enhance knowledge and skills, it also keeps them engaged and motivated since they know somebody from the center, somebody from the region cares about what we are doing. Significant progress has been made in integrating health services, but there is still need for the health sector to scale up integrated services to reach a significant proportion of people. And finally, I'll speak about the robust HMIS, which is critical in advocating for and sustaining actions to improve health service delivery. Next slide, please. So key takeaways. One is the significance of local ownership. Ownership is critical for sustaining any health programs. And by empowering the local communities, by empowering the leadership within the government structure, by empowering organization, UHSS ensured the sustainability and relevance of its intervention. The other key takeaway is the need for adaptability. The UHSS project was implemented at a time when we had an unprecedented pandemic, which was the COVID-19 pandemic. And UHSS ability to adapt to the challenges during the pandemic highlight the importance of flexibility and innovation as we implement health system strengthening programs. The other, which was alluded to as we presented our approach, is the importance of strategic partnerships. UHSS had a collaborative approach, and through this, we were able to achieve more than what we thought we would achieve with the resources that were available to us. The final key takeaway is the value of data-driven decision-making. A dual emphasis on health information systems and using data for decision-making resulted to significant improvements and transparency, accountability, and the overall efficiency in the health system. The regional referral hospitals are using data and are innovating decisions such as ensuring that the skill sets at the facility level are improved so that better service delivery is made, and many other decisions. I'd like to stop here for now. Next slide, please. Thank you. Over to you, Simon.
Localization based implementation.
Thank you so much, Dr. Betty, for the presentation. We've had a couple of questions come through the chat box, the Q&A chat box, and we've been able to try and respond to a couple of them. We have a couple of questions that haven't been answered. What has facilitated the institutionalization of regional joint review meetings funded by government? We have a couple of staff on call, and they should be able to respond to some of these questions, either in the chat box or in person. So I'm here with a colleague of mine, rather with some colleagues of mine who should be able to get in and answer this question. So we have a hand up. Who's that, please? Aiso?
I can't.
Isidoro Sunday. Is this Isidoro Sunday? Isidoro Sunday. Please, you have a hand up. Sandy? Sandy, please send your question through the chat. I will be able to.
Even the chat is disabled. Hello?
The chat is disabled? No, go to the Q&A, the Q&A box.
Where is that one?
Just on the, at the top, just next to the chat. Next to the chat icon, just on top of it. Yes.
Okay, Simon. Okay.
All right. So I would like to at this point we'll respond to the 1 and 2 questions as we go along, but would like to share a brief video on the UHSS achievements. So I'd like to draw attention to the video, please. Thank you very much. Over. Thank you for the applause. We hope you all enjoyed the video. We appreciate that it was brief, but we hope that we were able to capture most of what the project was able to do. And once again, we thank USAID, the American government, the American people for making this very possible. We continue to respond to your questions in the Q&A box, so please be patient with us. If you do have a question, please put it in the Q&A chat box just above your screen. It's just right next to the chat box. So at this point, I'd like to invite my colleague Stephen, our monitoring, evaluation, learning database senior technical advisor, to take us through the next session of this webinar, which is the experience sharing. Over to you, Stephen. Thank you.
Thank Okay, thank you, Simon. I hope you can all hear me. Good afternoon, good morning, and good evening to you all, depending on where you are joining us from. My name is Stephen Chikomeko, and I'm the Senior Monitoring, Evaluation and Learning Advisor, as well as Database Manager with the USAID Uganda Health System Strengthening Activity. And I'm happy to be your moderator for today for our experience sharing. And in this session, we hope to build on the previous sessions and discussions we've heard from the previous speakers. And our theme is for this great panel discussion is basically to hear voices from the field, realize impact, and inspire change. So our panelists have all been collaborating and working with closely with the USAID Uganda Health Systems and Activity. And I take this opportunity to introduce our panelists for this session. So we have a combination of panelists from the different levels of the health sector, just like Simon noted, from the national, regional, district, and community levels. And first, we have Dr. Sarah Byachika, who is the Commissioner of Planning, Finance, and Policy at the Ministry of Health. We also have Dr. Kabanda Richard, who is the Commissioner Health Promotion, Education, and Communication, also from the Ministry of Health. Again, from the Ministry of Health, we have Paul Mbaka, who is the Assistant Commissioner, Division of Health Information. From the regional level, we have Dr. Nathan Onyachi, who is the Senior Executive Consultant. That's according to the new structure. For those who are not yet familiar, this was the Hospital Director title in the old structure from Lila Regional Referral Hospital. And from the district level, we have Dr. Murani Elisa, the District Health Officer, Budaka District Local Government. And lastly, we have Mary Ronald, who is the community health extension worker from Lila City. So each panelist will have 5 minutes to respond to each of the questions, and we'll probably give a reminder to each of the panelists at around 4 minutes. And as earlier mentioned, colleagues, you can feel free to use the Q&A to send in your questions, and we'll be able to attempt to address them in the Q&A chat. So to begin, we'll start with Dr. Biachika Sar. Dr. Biachika, following as we come to the end of the USSS activity, how do you and your colleagues plan to take forward the lessons we've learned about the National Health Accounts production, and what else do you identify to make sure that generation of these reports are more efficient and independently managed by the Ministry of Health? Over to you, Dr. Biachika, sir. I think you're muted. Okay, so I think we'll move to the next panelist as we get sort of probably connectivity challenges with Dr. Biachika. We will move to our next panelist, Dr. Kabanda Richard. So Dr. Kabanda, the CHOOSE program is significant for Uganda to make even greater strides to improve the health status at the community level. So basically, what are your key focus areas in the next 1 or 2 years to scale up the CHOOSE program? Over to you, Dr. Richard.
Thank you, UHSS colleagues, for, first of all, for organizing this webinar, but of course also to mobilize many people to learn from what you have been able to support government with, but of course also some of the key takeaways for us to share with the wider community. I think right from the start, it's good for all participants and listeners to know that the government of Uganda has for a long time documented and indicated that we need to make strategic shifts from curative to promotive and preventive healthcare. And making baby steps has always been a very big challenge. Our community health workers program has been in existence for over 20 years, but based on previous assessments in 2014 and 2015, there are some grave challenges, and that led to the development of the new, more trained, more remunerated, or more facilitated, more equipped, and better organized and supervised cadres. That is the community health extension workers. For us, we believe that the existence of community health extension workers will heavily serve as the engine for the drive that will push us into the promotive and preventive agenda as a country, and driving that kind of effort. We know that in the previous 2 years, we have been able to pilot or to test the strategy that was developed in 2018 and 2019. That is through a pilot, and we thank USAID through UHSS and other USAID partners for supporting the initial training, which is very, very costly. As we speak now, we have done an in-depth assessment as indicated, and the essence of the in-depth assessment with support from USAID through UHSS was meant to showcase or to gather more evidence from the communities for districts where we did the pilot, whether the strategy as it was developed and implemented was actually successful. And the key recommendations therein ultimately are driving our next steps. So in brief, within a period of 2 years, there are 3 critical areas of concern. Number one, we would like to share with the wider community, that is all districts in the country and key stakeholders therein, to partners that support community systems, and of course also to many more other key stakeholders, including the development partners. The results from the in-depth assessment. The results from the in-depth assessment of the Choose pilot are going to serve as our advocacy tool, which will take us through the other second component as one of our key takeaways of engaging more partners, more development partners, more implementing partners, but of course also engaging government to increase funding in this area. Currently, the community health extension workers that we do have support was from, of course, from partners, but the remuneration is coming from government. And we'd like government to make more commitment to provide more resources in this area and also make the resources more regular. If I talk about government, yes, we are government ourselves, but we know that there are other MDAs that are more responsive to this financing component. So we believe that the in-depth assessment results will go a long way in pushing for this advocacy agenda. We have also been able to note that our first encounter with the few partners where we shared some of the results from the in-depth assessment, it attracted the attention, the results attracted the attention of more partners. And we have been able to confirm resources from some partners, from World Bank, from Global Fund. We also expect resources to come through from Africa CDC based on the results that were shared. And from that time, we have been able to expand beyond the 3 districts. We have now completed training in 4 other districts. There is ongoing training now in 4 other districts. We have also confirmed resources in 6 other districts. And we're also expecting confirmation of resources by end of this week to be able to onboard 6 other districts. So from the time when we did the pilot in 3 districts, we are now, by end of this year, we are talking of confirmed resources to onboard, choose training, and rollout and equipping in now over 20 districts. So our very last key major activity would be the national rollout. So we expect that by the end of the year 2, we should be able to have covered almost 40% of the entire country. With the goodwill and confirmations that we are getting, we hope that by the end of year 2, we should be at 40% coverage at bare minimum. So I conclude by saying that we do appreciate USAID through UHSS because many institutions do not want to test strategies that have been developed, and we have now evidence that in many parts of the world there are documents that are being developed and shelved. This hasn't been the case for our Choose strategy. We do thank you and we do appreciate, and we think that we shall definitely continue working with the technical teams and the capacity that has been built within the country in driving this agenda.
Thank you so much for your response, Dr. Kabanda. Our next panelist is quite unique, a community health extension worker working at the community level, and this relates to what Dr. Kabanda has just shared. Happy to invite Mary Ronald to share your experiences as a community health worker. What recommendations do you have for the failed districts, and even in district you are working in, on the best ways to support you, the community health extension workers? Mary, over to you.
All right. Thank you so much, Mr. Moderator. And I also want to thank my senior supervisor, that is Dr. Richard Kabanda, for that good elaboration. In the first place, I want to thank the USAID for the training that we had, and it was a very good training. And also want to thank the UHS for other capacity building that we have been encountering in the course of our services. The first recommendation that I want to say is that a community health extension work is a good strategy that is helping most especially the community to handle most of the health related problems at a community level and also at a facility level. But beside it, the following is always good for the next district that are going to take up on the recruitment and the expanding of the programs. One, in terms of selection, it would be better if they have involved the community members in a selection because it is going to make it very good and a good environment for such a chief or a community worker to work freely without anything like intimidation from the members. And secondly, on the age gap, we would prefer that because in the first place we were given 18 years to 35, but we also have other committed senior citizens who are having the zeal and the heart to serve as a community health workers, but due to the age gap sometimes can bring them out. So we prefer that if they could increase the age gap from at least 18 to 40, would also be good for other beneficiaries. And also, in terms of recruitment, we know very well that the Jews are being recruited two per parish, but sometimes in other parish we have some large villages where a Jew might not be able to cover, and if it is good, more Jews could be recruited in a given parish. It would also be of good importance. And another thing which is very vital and very important is the motivation in terms of the enumeration that Dr. mentioned. Currently, the Jews, as is stated, is being motivated and the amount is good, but in other setting, like in a city setting, you'll find that the money might not be able to fulfill some of their demands, and we prefer if they could make an increment in terms of their allowances being paid, it would give them a good morale in the executing their services. And also on the issue of the reporting, as per now, the Chiefs are doing a manual reporting that is through pens and paper, and it will also be very good if they have been digitalized. Though in other districts, a case in point in Mayuwe, they have been given the smartphone, but we would prefer that it could be a universal for all the districts where they will be expanding the Chiefs program. Issue of digitalization in compiling the data and also reporting would be of a better good importance. And another thing that will also make the best of the Chiefs work is the teamwork. And in teamwork, I mean the coordination starting from the village health team, if they can work hand in hand with the community health team, alongside the supervisors at a given district level. And lastly, to the ministry official in the policy, it would make a good impact on the other district that will be enrolling the program. And another thing which is very vital that we want us to copy is the refresher training for the chiefs. Because, you know, as a human being, sometimes knowledge comes, sometimes knowledge perishes. But it would be very good if the chiefs have been given more refresher cost on other services and the packages that they have been trained in before. It would be of a better good help to help them in carrying out their activities. Another thing is setting the committees within the chief structure. This is going to help them, one, in the monitoring and evaluating the work that they're doing, and also in the line of their discipline. Because, you know, in this work, it calls for discipline and other certain things. And another thing is the better means of transport. Though currently the chiefs are being given the bus call, but in other areas it is a large coverage, and you'll find that the bus call will cover, but not in a fast distance that can save and also help in the referring of the cases. So a good means of transport would be very good to help other districts in scaling up the programs. And also working in a close supervision. This is most especially by the health assistant and also the health inspector it will give a good impact as far as the chief's working concern. So briefly, that is my recommendation that I could give as far as the chief's work is concerned. Once again, my name is Merirona. I am a community health worker for Lira City, Northern Uganda. Thank you so much.
Thank you so much, Ronald, really for sharing these insightful responses. Our next question goes to Paul Mbaka. And Paul, with the progress made so far in developing and implementing of the digital health strategy for the Ministry of Health, what are your priorities with respect to institutionalizing the use of the various Ministry of Health performance dashboards to further strengthen data use for decision making at the Ministry of Health? Over to you, Paul.
Thank you very much. Allow me to associate with submissions from colleagues, particularly around thanking USID and the strengthening system strengthening activity for the support that they provided over the last 5 years. In answering this question, I think it is important for us to reflect upon the path that we typically take to monitoring and guaranteeing the results that we strive to receive. While our strategic objectives are indeed what we strive to achieve, those strategic objectives cannot be guaranteed if we do not have a mechanism to monitor that the management objectives are in place as an enabling mechanism for the strategic objectives. The dashboards that have been developed, for example, those that are tracking productivity of health workers, monitoring specific management indicators for different departments are critical in us ensuring that the assumptions that we typically make when we talk about our log frames are actually on course and can be in a place to support the deliverance of the strategic objectives. Between when you make your inputs and perform your activity, it is important for you to monitor whether the output that you expect can be guaranteed. And that is why it is important to make sure that you track functionality of the different departments and divisions within the Ministry of Health, that you can track attendance to duty of health workers, but the different process level activities that are expected to be conducted by clinicians at different levels are also tracked, and just in case they are off track, remedial action can be taken in time to ensure to guarantee results, but also that we can benchmark places where good practices or results are being achieved as a mechanism for learning and guaranteeing results in the other areas which might be struggling. So these management dashboards, first of all, are something that the Ministry of Health wants. We requested support to the strengthening system strengthening activity, and we appreciate very much the support that we received. Management within the Ministry of Health is quite keen to see that this works. The Ministry of Health has received capacity training on how to maintain. It is important for you to note that review and monitoring of these dashboards have been institutionalized within core Ministry of Health reviews, including the quarterly reviews, where we now have a slot where some of these management dashboards are reviewed and actions are agreed upon. So again, allow me to thank you for the support that we've received for the 5 years, and that indeed the support we received are things that we are going to continue. We appreciate the seeding that was done But I think the institution itself, the Ministry of Health, the health sector, has aligned itself to ensure that the investments that have been made so far will be carried on. Thank you very much.
Thank you so much for these insightful responses. The next question will be answered by Dr. Onyachi. I can see you on the call. Yes, so Dr. Onyachi, reflecting on the meaningful collaborations with UHS's activity that we've had over the past 5 years and the strengthened governance structures at Rural Regional Referral Hospital, how has this essentially translated into improvement of delivery of health services? And maybe also share what areas you think regional referral hospitals in general need to continue focusing on in the next couple of years. Over. Dr. Nishi? I think we need to unmute Dr. Nathan. Dr. Nathan, you seem to be muted if you are speaking. Okay, so as we sort out the connectivity challenges with Dr. Nathan, let's move to Dr. Elisa. So Dr. Elisa, can you share with us the changes you've witnessed in the prevalence of malaria in Butaka district over the past 2 years of work with UHS's activity, and what plans do you think you and the district leadership have to maintain these achievements and improvements? Okay. Let me continue. So I think Dr. Elisa could have also dropped off. So maybe we'll take on one question that we have. Maybe just get questions. Okay, so we had a question directed to Dr. Richard Kabanda from John. With the country suffering from chronic resource inadequacy, is it possible to advocate for facilitation of community health extension workers through local financing? Dr. Richard, if you're able to respond to that quickly.
The answer is absolutely yes. We have made computations here, and we noted that strengthening community health systems without well-trained, equipped, and facilitated community health workers may not change the status quo or the current narrative that we have. If you look at the indicators that have been tracked in the areas where we have community health extension workers within a period of 1.5 years, especially those that can easily be tracked, you see that there is some good progress. The reports we get from Lira district and Lira city, or especially on ANC attendance and others, it is really amazing. But in our computations, we noted that for us to have full coverage of the entire country, we need not more than 5% of our entire budget, of the current budget for the health sector. And approximately the budget for the sector is at approximately at 7%. So if an increase of the budget to slightly 7.5%, can actually make significant changes. It's just a matter of us prioritizing, increase the advocacy for this area, and letting many more other key stakeholders understand that this will significantly lead to reduction on the amount of money we invest on drugs and medicines and many more others at that level. So lastly, I would also say, moderator, that one of our key challenge, I would say, is the mindset of many of our people who take decisions over this requires more and more advocacy for them to be able to understand this. And to many politicians who take decisions, they definitely know that putting up structures or facilities in our sub-counties or parishes is what works. Yet, evidence from many other parts of the world, and also evidence now generated locally here, suggests otherwise. So the answer is yes, and we are ready to move into this direction.
Okay, thank you so much, Dr. Richard. I think we still have internet connectivity from the rest of the panelists, so I best can encourage, if you have any other additional questions, please continue using the Q&A and share those, and we'll be able to, again, continue directing them to the panelists for response using the chat. So once again, it was great hearing from each of the panelists. We really appreciate you sharing these invaluable insights and the great work that we have achieved through the collaboration and support in the USAID UHS activity. So we will have the next session where we will have Sarah be able to share some of the key areas, opportunities, and takeaways that have come through this experience sharing. And so, excellent. So thank you. And once again, just want to give a big round of virtual applause to each of our panelists. If you can, feel free to have that, virtual clap, and really to express our sincere gratitude to each one of you, and also to the audience for the active participation and the questions that we've been coming through. And it was really been a great pleasure moderating and have you all share again your experiences. I'll now invite Sarah to basically take us to the next agenda item, basically summarize some of the key, takeaways, opportunities that have really come through this experience sharing and overall, and also be able to take us to the closing agenda item. Over to you, Sarah.
Great, thank you, Stephen. Thank you, everyone. My name is Sarah Stratton, and I have had the pleasure of serving as the US-based project director of the USAID UHSS project for Palladium. And it's an immense honor to join everyone today to reflect on the journey of the UHSS activity. Thank you, Stephen, for your moderation of the last session, and a big thank you to our wonderful panelists for their invaluable reflections, despite some of the internet connectivity, and their insights about the various health systems issues facing Uganda. So we heard a couple of times from Dr. Kabanda on the importance of community health systems and what the government is planning to do in the next couple of years to scale up the community health extension worker program that the UHSS activity, along with the Ministry of Health at the various levels of the health system, has piloted. And then we've also conducted the in-depth assessment to show what are additional learnings that the government can use to scale up this program. And I think his point around transitioning to a greater focus on promotive and preventative care versus curative care is very important. He mentioned how the in-depth assessment can be used for advocacy, the importance of engaging the government to increase funding, particularly for remuneration, and how we plan to extend to other districts, hoping to reach a national coverage of 40% in the next couple of years. And then it was great for us to hear from the community health extension worker himself, Mr. Rowland. He provided some insights on what community health workers in other districts could do, and also to the government in terms of the importance of really involving the community in selecting those community health extension workers. And I think now, despite the a great proportion of the population that is younger, it's also important to recognize that we have aging issues to be addressed, and his suggestion around extending the age band for community health extension workers, and also how to adapt perhaps remuneration according to the context, being as he's an urban-based community health extension worker. So we really appreciate the work that he does as someone on the front lines, meeting Ugandans where they are and addressing their health issues. And also the importance of digitization, which we're all confronting in our various aspects of our work. And Mr. Mbaka raised the very important issue of connecting what's being monitored to what is going to be digitized, and how those various dashboards that we have worked together as UHSS and many of the other partners with the Ministry of Health to create, so that those dashboards can provide the data that is helping the ministry to monitor their progress, and also to look at where they need to intervene, perhaps on different HRH issues, as well as being able to identify and share practices at the various levels of the health system, and the importance of that data in the different reviews, such as the joint system review. Unfortunately, we couldn't hear from several of our other colleagues, but if we can, we'll certainly share their insights afterwards. So again, I would just like to thank each of you for joining us today, for your valuable contributions as we've journeyed along this road to strengthening the Ugandan health system. And I'd like to take a moment to also really thank my UHSS colleagues, who are an amazing group of colleagues. And it has been my immense pleasure to work with them over the past couple of years, to be able to witness their tenacity, their ingenuity, and innovative way of thinking, being solution focused. And also all of our various consortium partners. Again, I just like to recognize CSBAG, IDI, KPMG, and Panagora Group. It's been great working with everybody. And of course, our primary stakeholder and partner has been the Ministry of Health, from the national level to the regional and district level, and all the way to the community level. The MOH has been an amazing partner, has been open to fostering and maintaining a strong partnership with the UHSS activity. And there are many other institutions, too many to mention individually today, that the USAID UHSS activity has collaborated with and who have contributed to the success of this project. But more importantly, they've really helped work together to strengthen the healthcare system in Uganda. I thank each of you for attending today and for your ongoing partnership with the UHSS activity. And finally, on behalf of the UHSS team and Palladium, I extend my sincere appreciation to USAID Uganda for the opportunity to work in close collaboration with you over the life of the project. Your support for the UHSS activity has been unwavering, and you have also challenged the team and our partners and stakeholders to remain solution-focused, to query the data to drive those solutions, and to leverage our collective experience to improve how well the health system functions. Following your guidance, UHSS, together with the Ministry of Health and our numerous other stakeholders, has strengthened the health system, leaving it stronger and better equipped to serve the population of Uganda. So we thank you again.